I think I want to make sure transition here to our last speaker. And I would say, our last speaker is both, a leader and a connector. Nick Watts is a medical doctor trained in both public policy and population health. He's the director of the UK Health Alliance on Climate Change, and he's also the executive director of the Lancet Countdown, the continuation of the 2015 Lancet Commission on Health and Climate Change. And I'm going to ask him to come to the stage now and tell us more about it.
Okay, so there you go. I am in the somewhat dangerous and definitely unenviable position of standing between you and, or being the last part of this organised program, standing between you and a drink somewhere outside. But if you had to pick someone to take that role, at least you picked an Australian, because you know for sure that I'm on your side when it comes to that. I'm going to talk through, for the timer tells me 7 minutes and 36 seconds, a little bit about not all of planetary health, but one tenet of it that we're working on with this research platform, the Lancet Countdown, tracking progress on health and climate change. Maybe talk a little bit about how we got to where we are today, and throw a few thoughts out about where we might be going in the next 5 years, maybe in the next 10 years if we get ambitious. So I won't cover anything about the health impacts of climate change because that would be inappropriate, given that most of the people in the room probably know a fair bit more about that than I do. And even if I was going to, that diagram probably wouldn't help me very much. But what it does do is it reminds me of some of the key messages from the first sort of publication in this series, the 2009 Lancet Commission on Health and Climate Change, which really focused on the health threats and the impacts, and the complexity of this diagram reminds me of what we get really concerned about, these multi-hit scenarios. What happens when you start to wear down at a community's sort of local resilience, when you get hit again and again by flood, by the spread of sort of new infectious disease, when you start to wear away at the resilient capacity of what should be an anchor of good health, the health system. I also won't talk through the health co-benefits of mitigation or the response. And again, if I was going to do that, this diagram would probably not help me do that either. But it does remind me of the next of those two publications, the 2015 Lancet Commission on Health and Climate Change. And it reminds me of, I think, the three sort of, for me, the most salient message that came from that work, which was we looked at all of the different things you might want to do to respond to climate change, and we asked the health professionals on the commission, what do you think of this? And they said, well, all of this looks like it's pretty good for health. And then we asked the engineers and the sort of transport experts and sort of urban spatial infrastructure experts, and they said, well, actually, a lot of the technology that you need to do this, that exists. We're fairly confident that it exists, and we can roll that out over a time period that is very possible. And we asked the economists and the finance experts about how you'd go about doing some of that, and they said, actually, it doesn't cost that much, and you're going to get a lot of that money back, probably more back, in health savings and in sort of strengthened economies. And that, to us, sort of summarized, or I summarized the 2015 work in this sort of statement that the response to climate change has the potential to be the biggest global health opportunity of this century, but it is so incredibly possible. It's no longer a technological, a technical, an economic, a financial issue. It is now entirely a political challenge. And so that brings us to this slide. This is, if you haven't noticed the sort of trend, my slides are mostly just sort of pictures of logos or complex diagrams. The story so far brought us from, on the one hand, in 2009, climate change is this terrifying threat to human health and to the progress we've made in development and public health over the last 50 years. In 2015, the response to climate change is this opportunity. And all of this happened in the context, or is happening in the context, of what is perhaps a challenge to evidence or to science as some sort of decision-making tool for public policy, right? This sort of rise of populism that I think we started to see over the last couple of years. And it's also happening in the context of the Paris Agreement, this remarkable framework which is set out in 2015, which is exactly that, a remarkable framework. And it becomes a remarkable opportunity if we go through and implement that. to the friend of mine in the room who is calling me, presumably trying to put me off. It didn't work. Thank you, though. And that was the challenge set to us was, okay, by the Lancet, build a platform, go away, build a platform that can respond to this, that can tell the story of climate change as a threat, but the response to climate change is an opportunity. Track countries actually delivering that, actually realizing these opportunities, and do so in a context of the Paris Agreement, tracking that as it is implemented, but also in the context of a world that is questioning the role of science in public policy. And in many ways, what we came up with is a pretty well-worn public health tool. It's a sensible sort of response for a doctor, a nurse, or a public health professional, is to gather the evidence, to assess that within the context, and then provide recommendations forward for their patient or for their city or for their country or world, as the case may be. And so that's exactly what this collaboration does. We are a large platform of, I think, a few too many logos right the way around the world. Many of the collaborators and sort of lead researchers in the partnership are in this room, and I think we've heard from quite a few of them today. Principally an academic collaboration with a few UN agencies, as you can see, thrown in there. 2 strategic partners in Wellcome and the Lancet that sort of make all of this possible. What it is that we're doing is on an annual basis tracking a whole range of indicators of progress on health and climate change, reporting them every year in the medical journal, The Lancet, which I think most of us should have heard of by now. It's probably been the one feature that I've heard mentioned in every single presentation so far today. And these are the sorts of indicators that we're tracking. We have in October coming up a whole series here. We have people from each of our working groups, which we split our work up into. So the health impacts of climate change, the response side, looking at sort of health resilience and adaptation, the health co-benefits of mitigation, the economics and the finance, and the political and the broader context. There's a few caveats that I have to put up around some of these indicators, which is that when we sat down to look at all of this is a complete list of everything we'd like to track. Now, as it turns out, the world's a complex place, and data, as we've heard, isn't quite as good as we'd like it to be. And so one of the key tenets of this project is that we're existing to get started and not let the perfect be sort of the enemy of something that's possible. We have to get out today and sort of push out our first publication for 2017, and it's going to be a very good sort of first effort. But I suppose what I'd like to caveat it with is each of these indicators are, in their own way, their own sort of research project going forward, and we're going to work on developing them and getting better at pulling all of that together. As well as that, we recognize that tracking some of this at the global level leaves out some aspects of the relationship between health and climate change, and there are certain things that don't necessarily lend themselves to global level or national level indicators. And so we as well have a series of national reviews, 4 pictures for 4 national reviews that are in the works at the moment. Mental health in small island developing states, coal phase out in China, the health benefits of meeting the UK's Climate Change Act, and phase out of diesel in Tehran. And these are sort of trying to really drill down into some of the policy responses and the sort of initiatives that, that perhaps give life to these indicators. So I'm going to finish up pretty quickly. Just to talk, maybe posit some of the places that we're going to head forward in the near future. Like I said, each of these indicators is its own research project. Ideally, we're going to start by looking at a lot of state changes, a lot of process-based indicators. Ideally, we'd like to develop these into a place where we start to get towards the actual fact, towards the health outcome. But you have to start somewhere, and like we said, we're not going to let the perfect sort of be the enemy of the possible or be the enemy of getting us started with this platform. And to do that, I think we need to start thinking pretty seriously about the data that we're drawing in. Some of this is going to be top-down, and some of it's going to come from some of the UN agencies that we work with. Some of it, though, is going to have to be built from the bottom up, and there are all sorts of infrastructures that have to be put in place to try and enable that going forward. we're also going to start thinking a lot more seriously about the communications of some of these indicators. Putting up slides with all of those indicators or writing even a paper about all of that probably is going to bore most people, because I agree data can be boring. But it can also be really interesting if you can bring it to life. And so those visualizations, putting a human face on what we're looking at, and providing simple messages, really simple messages, and repeating them again and again is going to be something that I think you'll hear a lot from this platform. And the final thing I think that we're probably going to have to sort out is, I haven't heard it brought up today, but the correct pronunciation of data. And so as well as the paper in October, as well as the 4 national reviews, you can also expect a paper, probably just from me. I imagine I'll be the only author on that. Maybe we have another Australian in the collaboration on that. To finish up, this is our platform. It's designed to sit at the heart of academics, of communications, and of policy, providing decision support, impact evaluation, but also clear communications with a robust evidence base. It can go in lots of different directions, as you can see, and we welcome all sorts of suggestions and input, and people haven't been shy with that, so thank you. But I suppose a little word of caution or a warning. For those of you who do come with suggestions or ways that we can improve on this, the immediate response is, thank you so much, can you help us do it? And so we're a very open, very collaborative platform, and we're looking to develop this going forward, and we need help. And so I'm going to finish on that, but thank you very much.